Order, order. Before we begin, I would remind members that Mr. Speaker is encouraging all to observe social distancing and to wear masks. I call on Chris Loder to move the motion.
Thank you, Mr. Hollowburn. It's a pleasure to serve under your chairmanship today, and I'm grateful to the House for allowing time for this very important debate. Coronavirus has created pressures on all public services, the likes of which we have not seen before. When those services are critical for preserving life, pressure or increased absenteeism or greater demand is significantly more noticeable. Mr. Hollowburn, many constituents of mine have had awful experiences where they have had to wait hours for an ambulance. 4, 8, 10 hours, either for themselves or a relative. I've applied for this debate today because more recently constituents have been in touch to share their despair, often family members of vulnerable people, telling me that they have had to wait for an ambulance for many hours, even in urgent circumstances. A constituent of mine had to stay by the side of his late father's body for 9 hours before an ambulance was able to attend to his father and take him away. The shock of finding your father unexpectedly dead at home is shock enough, but I cannot imagine having to sit beside a loved one deceased for many hours waiting for help that just doesn't turn up. Another constituent in her 80s waited for 10 hours after she had broken her hip at home. Another was identified as having a stroke by a doctor who lived nearby, and because they could not wait for the ambulance, he kindly drove her to the hospital directly. There are many such stories, and I am sure that West Dorset is not the only area in the United Kingdom that is experiencing such difficulty, and I am sure that I am not the only MP to hear of these stories. My intention with this debate, Mr. Hollowburn, is not to pile criticism onto the South West Ambulance Service at all. But I know that in West Dorset and the wider South West, our ambulance service has been working to absolute capacity until they simply cannot do any more. Any diligent MP cannot stand by and allow this situation to go on without proper scrutiny, and it is clear to me that something does need to change. The failures we are seeing are not coming from incompetency or inefficiency, but from a greater demand upon the health systems we have in place than they are capable of handling without further backup. A lack of social care options for people fit for discharge, which has caused backing up throughout the hospital system, has ultimately compounded this situation, where ambulances have often needed to queue outside A&E for hours, with patients often having to wait so long that they are triaged in the ambulance. Ambulance drivers are in frequent close contact with vulnerable people. They have needed to be even more vigilant than the rest of us about self-testing and isolating when required so they do not infect their patients. While this sense of care and responsibility is, of course, their duty, it has resulted in higher levels of absenteeism than the ambulance workforce has been able to manage. But when you compound these issues, absenteeism and capacity pressures in hospital, resulting in ambulances queuing at A&E, unable to leave until they have safely transferred their patients into the care of hospital staff, they are unable to respond to the next call. The result at home in West Dorset is a lack of ambulances available, with people waiting for some hours, sometimes in great pain and distress. When our civilian services are in this situation, during a national crisis or not, the last step of escalation is to government for Ministry of Defence assistance. I'd be delighted to give way to the Honourable Gentleman.
Can I congratulate him and spoke to him beforehand? It's an absolutely superb debate because it will probably encapsulate all our thoughts, and I know the Minister will wish to respond to it. As grateful recipients as we are of army medics in our hospitals during COVID-19, and indeed even this week in the Ulster Hospital, just on the edge of my constituency, help is currently being given by 50 to 60 medics. Does the Honourable Member not agree, that there is a very clear role for the Army to play, and that role has not ended yet, and further that we again owe a debt of gratitude to those who serve us in times of war and also in times of peace in our wonderful armed forces.
Thank you, Mr Hollowbone. I cannot agree with the honourable gentleman enough. I'm delighted to be part of the Armed Forces Parliamentary Scheme and spending time with the Royal Navy at the moment. And it is clear for me to see that all those who don't only dedicate their lives to service of this country in the armed forces, but have gone so far in supporting and helping those who've needed it in the most difficult of situations are indeed to be commended in many ways, much more than I can do in this debate this afternoon. But Mr Hollowbone, whilst we understand that the capacity of the armed forces themselves is not limitless, we unconsciously rely, safe in the knowledge that in the most dire of circumstances, our service personnel will be able to step in and avert a real crisis from taking place. And when this does not or cannot happen, the resilience of our emergency services does indeed come into question. My own local ambulance service, the South Western Ambulance Service, first started to scope their request for military support in July last year. There were 6 operational and clinical areas where they were seeking additional support because of increased activity and absenteeism due to coronavirus. Of those 6 areas, only one was fulfilled. And after many weeks of negotiation, the South Western Ambulance Service received a very limited military personnel on the 11th of August last year. 18 soldiers to fulfil logistics roles, who also replenished equipment on ambulances until the end of August. 18 soldiers, Mr Hollowbone, much appreciated, but only 18 for 5 million people in the South West. The South Western Ambulance Service had also asked for clinicians, blue light drivers and mechanics, amongst other roles, but these requests were not granted. I know that it is not the role of Her Majesty's Armed Forces to indiscriminately provide any and all support to civilian services that is requested. Of course it isn't. However, in March 2020, when the Secretary of State for Defence said from me downwards the entirety of the Ministry of Defence and the armed forces are dedicated to supporting the nation getting through it, and of course the 10,000 personnel were put at high readiness, thus making 20,000 personnel available if needed, we might be forgiven for believing that assistance from the government might be more forthcoming in this case. The period of the coronavirus pandemic has been one where our armed forces were at their most ready to assist civilian services and should be commended for it. Of course, more services required help, and so military assistance had to be spread more thinly, but it was surprising to discover that the MACA request from the South Western Ambulance Service was only fulfilled to an extremely small extent, and that for me and my constituents gives great cause for concern. And that mainly was as a result of the original request being filtered down and weakened by some civil servants before evaluation, and that is, Mr Hollowbone, of great concern to me as a South West MP. I have no doubt that difficult decisions had to be taken. The armed forces are needed operationally for so many things. To ask them to support civil services is no small request in terms of resources, and of course the military cannot simply be diverted away from their primary role. However, given the extent to which we have experienced ambulance waiting times, citizens waiting in pain for such a long time, and the watering down of the needs of ambulance services before these evaluations took place, I question whether there are things that can be learned to improve the process of MACA requests in the future by looking at examples such as that from these I have outlined this afternoon. Ambulance services exist to respond to acute and critical events. These are situations that cannot, by definition, wait without potentially endangering life. When compared to another operational deployment of the armed forces seen in the pandemic, testing, for example, one does have to note that whilst testing was vitally important for oversight of the overall size of the pandemic in the UK, A timely COVID test does not compare in terms of urgency, waiting in acute pain for hours, a person in their 80s, for example, having broken their hip, or a suspected heart attack, or even a suspected stroke. Perhaps in the future, we ought to have a better publicised hierarchy of need for when we are faced with such a crisis, which requires military support to the civilian authorities. I cannot pretend to know the intimate details of every MACA request submitted to the government, but I can think of a few more acute and urgent services that might need prioritised support, but none other, I think, than our ambulance service. One of the criteria for MACA provision is that military aid should always be at the last resort, and that the use of mutual aid, other agencies and the private sector must be otherwise considered as insufficient or be unsuitable beforehand. I would also, Mr Hollowbone, like to pay tribute to the St John Ambulance, because the St John Ambulance has provided much support and continues to do so. It is a volunteer army in itself, with a deeply held mission to help those in need. I wonder whether or not there needs to be a more established role for the St John Ambulance in this area, to be able to more readily and structurally respond to some of these needs with a more substantial role to play in our nation's resilience arrangements and to support the emergency services. This would enable ambulance services to receive support more readily than we have seen in the cases I have outlined this afternoon. I know that the South Western Ambulance Service did not and does not ask for help lightly. Only when the situation for their patients was approaching very difficult indeed did they contact the government for help. And I should say it is only from my own intervention and inquiry that the ambulance service have kindly shared some of their insights with me. And even I was surprised, though, to hear that only 1 out of 6 of their specific requests were partly fulfilled. Mr Hollowbone, this debate, I believe and hope, will offer an opportunity for the government to review and improve the systems surrounding MACA requests. Greater clarity and transparency for those services making requests is needed, so that they know what levels of support they can expect, especially with no alternative. Because then, my colleagues and I, MPs of Dorset and the wider South West, will be able to further support the ambulance service in making sure that we never experience some of these difficulties again.
The question is that this House has considered requests for military aid to civil authorities during the COVID-19 outbreak, and the debate could last until 4:30. Ed Arger.
Thank you very much, Mr Hollowbone. As ever, always a pleasure to serve under your chairmanship. And I congratulate my honourable friend, the member for West Dorset, for securing this debate, and pay tribute to him for the manner in which he conveyed some very challenging personal experiences that his constituents and others had experienced. I'll turn a little, first of all, to the situation faced by ambulance services, and then I will turn to perhaps help clarify for him that many of the expectations that are not realistically achievable within the constraints of resources within the military of specialist posts, but I'll turn to that in due course. Ambulance services have faced extraordinary pressures over the past 18 months, and I know that all honourable members would wish to join with me in paying tribute to all those staff for their dedication and their hard work. The pandemic placed significant demands on the service, and in December 2021 the service answered almost 1 million calls, an increase of 22% on December 2020, placing significant pressures on ambulance service and the wider NHS. We know the background to the reasons for this: infection prevention and control measures, higher instances of delays in the handover of ambulance patients into A&E, and of course, crucially, staff absence rate, but flow through our hospitals, which is always the key determinant of the ability of ambulance services to offload patients into the safety of an A&E, is the ability of that A&E to get those patients either discharged safely or admitted to hospital. A combination of these factors has placed unprecedented stress on the service and driven increased response times to patients in the community. Despite these pressures, performance for Category 1 calls, the most serious calls classified as life-threatening, has been largely maintained at around 9 minutes on average over the last several months, despite a 16% increase in these calls compared to before the pandemic, though we are clear that there has been a significant increase in response times across other categories. It's exactly because of these pressures that we've put in place strong support to improve ambulance response times, including a £55 million investment in staffing capacity to manage winter pressures to March. All trusts are receiving part of this funding, which will increase call handling and operational response capacity, boosting staff numbers by 700. Improved health and wellbeing support, with NHS England strengthening its health and wellbeing support for ambulance trusts, with £1.75 million being invested to support the wellbeing of frontline ambulance staff during these pressured times. And of course, more broadly, NHS England is undertaking targeted support to the most challenged hospitals to improve their patient handover processes, helping ambulances get swiftly back out on the road. This is focused on the most challenged hospital sites where delays are predominantly concentrated. We've got a £4.4 million capital investment to keep an additional 154 ambulances on the road this winter. Now, the crux of the Honourable Gentleman's speech was to acknowledge those pressures and look to the military through the MACA system for further assistance. The scale of the challenge we faced and continue to face cannot be underestimated. The UK, like every other country in the world, saw their health systems and their capabilities stretched to the limit. So, as many of our civilian agencies and institutions struggled to cope, we should take great pride in the role our armed forces played in assisting them in responding to the pandemic. They reacted with skill and agility. But we must be cautious about the limitations on those numbers of skill, those who are qualified to drive blue light ambulances or indeed clinicians. So I have to say that 20,000 personnel my honourable friend spoke of, only a small proportion of those would be clinically qualified to assist as paramedics or qualified to drive a blue light service. Of course, I give way.
Can I thank the Minister very much for permitting the intervention? I completely understand some of the difficult points he is making, but would the Minister agree with me that the St John Ambulance has a wonderful suite of resources and could actually play a lot more substantial role going forward in terms of supporting our emergency services?
Minister.
Well, I'm grateful to my honourable friend. I'll address that point and then return to the military point. Yes, indeed, I've had a very productive meeting with the St John's Ambulance in the past couple of weeks to discuss exactly that. They have, of course, we shouldn't underestimate the huge role they already played throughout the pandemic in supporting our ambulance services and our other emergency services. I'll give way to the honourable gentleman, then I'll make a little more progress.
Jim Shannon.
Again, and I was just sitting here thinking that, and obviously it's not the Honourable Gentleman's constituency, but in Northern Ireland, as we have in the Territorial Army, we have the Medical Corps, who are based in Belfast. Now, every one of those people, not every, but the majority of the people who are in the Medical Corps are those who are probably NHS staff. They're either doctors or nurses or whatever. That's where their interest comes to be in the TA. I'm just wondering, will there be circumstances here in the mainland, perhaps, Minister, where the expertise of the Medical Corps TA section could actually be used to the advantage and address the issues of shortcomings when it comes to staffing?
I'm grateful to the honourable gentleman. I think it's important that we take advantage of all opportunities that exist with those qualified professionals and their ability to support our frontline emergency services, more regular frontline emergency services. Just picking up on the honourable gentleman's points about MACAs and military capacity. The large number of that capacity of 20,000 was used for testing, was used for helping building Nightingales. We see them now, or have recently seen them, helping in vaccine testing centres. But the capacity, for example, of clinically qualified army medics is very limited, and often they are already army medics who already serve in the NHS and in hospitals. So there isn't a huge pool to draw upon. Therefore, it is important that we are clear about that. And secondly, I mentioned to the honourable gentleman the point about those qualified as blue light drivers. Again, that is not all of those 20,000 or anywhere near. So we've just got to be realistic is the wrong word, but careful in our expectation setting about what the capacity is to support very specific requests, which is what his ambulance service put in about specific support and specific types of support. More broadly, there has been considerable support offered by the military in tasks such as logistics, as he highlighted, in supporting, for example, ambulance service in a range of roles. So currently, the Ministry of Defence is providing support to ambulance services in the following ways. 366 personnel are providing support to ambulance services in a range of roles, including non-driving roles. There's a range of roles there. 96 personnel continue non-blue light ambulance driving to support the Scottish Ambulance Service, and 313 personnel are providing driver support to the Welsh Ambulance Service. Now, my understanding about the specific request, he refers to specific matter. This was incorporated as part of a broader request for ambulance drivers between the 10th and 31st of August of last year. And that the request, or the element of that request which was granted, was the 28 Category C drivers, which was provided by the Ministry of Defence. But I come back to that point that he's right. The military is always there for us to assist us in times of need. But equally, we do need to be realistic about just the capacity they have in those specific places. I suspect he wants to come back in.
Thank you, I appreciate the Minister's candour in this debate. But I would just like to respectfully remind the Minister that the fundamental issue that we are dealing with here is where we have constituents, patients who are in great difficulty for a long time. And I fully appreciate the many pressures of which he outlines, but I think what I'm really looking to achieve through this debate, and I'm hoping that he can help me a little bit further, is that for those, particularly those families and those individuals who have gone through these quite painful experiences, as to how we can make sure that we don't get into this position again, rather than us facing the fact that constituents and others can be on their own waiting for such a long time.
I'm grateful to my honourable friend. He will have heard me set out exactly how we've done that with the extra investment in our ambulance services, and that is the key, to reinforce the strength and the resilience of our existing ambulance service provision. He's absolutely right to highlight the impact, the patient impact, the familial impact of long waits for an ambulance and the impact that that can have. But the real answer here are the measures we are taking both to invest in the ambulance service, the £55 million more, and the investment we're putting into hospitals to ensure they were ready for winter, but also that broader funding across the piece we're putting into our healthcare system to further strengthen it. And we've seen today another element of that package around the announcement of waiting list recovery and how we intend to approach that. It's absolutely right to highlight the military. They are there, in extremes, they are there to help in very specific, very pressured circumstances, but they are not the solution to this problem in the long term and to actually avoiding these challenges recurring. That's why we have our plan, not only for the ambulance service, but for improving urgent and emergency care. And we saw £450 million invested over the past 18 months or so to improve A&Es across the country to help them function more effectively, particularly in the context of IPC measures. But more broadly, we are investing in our acute hospitals to allow for that flow of patients out of A&Es and into the hospital, or hopefully discharged home. That's the key to solving this. Of course, I could wait till we get...
Loder.
And for giving way, and I'm very pleased that he's highlighted that, because I should highlight and thank the Minister again for the £65 million which the government has dedicated to Dorset County Hospital in indeed addressing this very difficulty.
Well, I'm grateful to my honourable friend, and he's quite right to highlight that, not least because of his role in continuing to argue for it and support Dorset's hospitals in this context. The military have done, and continue to do in the context of this pandemic, a fantastic job. But as I say, the key to this is long-term investment, which is exactly what we're putting in place. I'm very conscious that the challenges faced by all ambulance services over the winter, but I know that his local ambulance trust faces specific challenges as well, of geography, of distance, and of locations of hospitals, which can be challenging for them on occasions. So I do appreciate the particular complexities of the system in the South West. We continue to work very closely with the local system, but also, where appropriate, with the military to see where they can support us and help add additional resilience in the system. But there is no substitute, I think, for the investment we are putting in, the need for which he has highlighted again today, into making those systems more resilient in the long term. And we continue to focus on outcomes for patients, which is exactly, I think, where he comes from in this context, to avoid or reduce the risk of people having to wait a long time for an ambulance in very, very challenging circumstances. It remains a very high priority in my ministerial inbox to tackle and improve the performance of our ambulance trust. That's in nowhere criticism of the amazing work their staff are doing, but they are faced with very significant challenges. We continue to focus on them, and I look forward to working with him and his colleagues in Dorset in the context of meeting those challenges in the South West. Thank you, Mr Holborn.
The question is that this House has considered requests for military aid to civil authorities during the COVID-19 outbreak. As many as are of that opinion say aye. Of the contrary, no. I think the ayes have it. The ayes have it. Order, order. The sitting is suspended until 4:30.